Listeriosis, also more commonly known as listeria, is a serious infection usually caused by eating food contaminated with a certain bacterium. Now, this food can range from cheeses to ice cream to things like cantaloupe and raw meats. And this bacteria, the causative agent, is known as Listeria monocytogenes. The disease specifically affects elders, pregnant women, newborns, and adults with weakened immune systems, but it can also infect invertebrates such as birds and mammals. In humans, there's a mean mortality rate of about 20 to 30% or higher. And we most commonly know this disease from bluebell, the most recent outbreak, which I will get to in a little bit. Just a little bit of history on the disease. It was first recognized in tissue samples in Germany in 1891. And then Listeria was isolated from the liver of rabbits in Sweden in 1911, later recognized in sheep in Germany in 1925, and it wasn't named Listeria monocytogenes until 1940. In 1983, we had the first human outbreak, which occurred in Canada, and this confirmed the indirect transmission of the disease from animals to humans. And then most recently in 1985, the outbreak in California confirmed the role of food in transmitting listeria. So Listeria monocytogenes is one of two listeria species that actually infects humans. It can survive and replicate in really unfavorable conditions, such as a huge broad temperature range from 1 to 45 degrees Celsius, acidic conditions, and high salt concentrations. And it's always been known as an animal pathogen, but increasingly within the past 10 years, it's been known as a human pathogen. And if it is a human pathogen, it's mainly infects through food source contamination. Specifically, this bacteria is very small, about 0.4 to 0.5 micrometers, and they're short rods with rounded ends, and they actually curve in a single or short chains that form like a V shape. They're ubiquitous in nature, meaning they exist everywhere, which is why this disease can commonly arise. And they're gram-positive, facultative, anaerobic, and motile. So out of the 12 strains, there's only 3 that are associated with human listeriosis. These are 1/2 A, 1/2 B, and 4B. And over 95% of all human infections are caused by these 3 strains, and these 3 strains are associated with all of the major foodborne outbreaks. So, like I said, they're ubiquitous. They exist everywhere. So, soil, water, infected animals, human and animal feces, raw and treated sewage, leafy vegetables, raw milk. Listeria monocytogenes could be present in all of these. They're also present in ready-to-eat foods usually. And there's a recent study that showed that Listeria monocytogenes grew from at least one food specimen in the refrigerators of 64% of people with a Listeria infection. So this means that 64% of all the people that are infected with Listeria are infected by something in their own fridge. And then also another study by the FDA showed that 1 to 10% of humans may be intestinal carriers of Listeria, meaning they don't have to show symptoms or get sick, but they still have the bacterium in their stomach or intestines. So in the USA, there are 1,600 illnesses and 260 deaths annually. In 2013, there was 0.26 cases for every 100,000 individuals. And in 2012, there were 4 confirmed outbreaks in the USA. Now, this sounds pretty bad, but compared to 1996 to 1998, and then comparing that to 2009, we've actually seen a 30% decrease in the number of infections. So that's good. Some general transmission facts. It can be transmitted mother to fetus via maternal bloodstream or sent from colonized genital tract, or it can be a foodborne transmission, which this is 85 to 95% of the disease cases. And if it is this, then it's the major portal of entry is the intestinal tract. This is just a little graph showing some of the foods that Listeria can hide in, such as sprouts, deli meats, smoked seafood, soft cheeses, and raw milk. And then infection of this disease is poorly understood, but we do know that the primary site of entry is the gastrointestinal tract. Once it is ingested, the clinical source of infection begins about 20 hours later, and then the incubation period is about 20 to 30 days. All right, so only a small percent of people who ingest Listeria actually fall ill or develop symptoms. These can include fever, chills, severe headache, vomiting, nausea, diarrhea. And then if the infection spreads to the central nervous system, you can develop headache, stiff neck, confusion, loss of balance, or seizures. And then even further, life-threatening forms of listeria are characterized by septic shock, and they lead to like meningitis and encephalitis, which are severe brain diseases. And then specifically pregnant women, when they're infected, they can develop an acute fever, muscle pains, backaches, and headaches from this disease. To be diagnosed with this disease, doctors usually do either a blood or spinal fluid test. And then if it's a woman and she's pregnant, they can take amniotic fluid or placenta samples. And then an MRI is used to confirm or rule out brain or brainstem involvement, which is also important when differentiating between encephalitis and meningitis in those. And then it's really important to diagnose listeriosis in high-risk patients really quickly, especially pregnant women, because at that point there's an increased risk of stillbirth or preterm delivery for the child as well. And then the death rate for humans with listeriosis is about 10 to 50%, depending on the risk group, which I will talk about next. So these risk groups: pregnant women, 14% of cases occur during pregnancy, and pregnant women are 10 times more likely than the general population to get this infection. And if they get this infection, besides the symptoms to their own body, they can cause fetal loss, preterm labor, or illness and death in their newborns. Elderly or the older adults, 65 or older, 59% of cases occur among them, and they are 4 times more likely than the general population to get a listeria infection. And then lastly, people with a weakened immune system. So this includes people already sick or people with cancer, diabetes, or kidney disease especially. And then also people with AIDS are 300 times more likely than people with normal immune systems to get this disease. All right, like I said, meningitis can be one of the severe cases arising from listeriosis. And meningitis is basically inflammation of the meninges, which are protective membranes covering the brain and spinal cord. And these can cause symptoms, as well, I guess not simple, but something from basic like rashes all across the skin to loss of limbs and severe brain trauma, like this child. And then encephalitis, on the other hand, is inflammation of the actual brain. And this causes a lot of mental issues such as personality changes, epilepsy, memory problems, fatigue, stuff like that. So this is also a very serious disease. All right, and then some outbreaks. So the melon outbreak of 2011 was the biggest outbreak in history. And this is where contaminated cantaloupe sickened at least 146 people, led to 142 hospitalizations, and 33 deaths. It originated in Jensen Farms in Colorado, and it spread to 28 states. And then the most recent outbreak was bluebell earlier this year, and this arose from contaminated ice cream and frozen treats, which sickened 10 people, hospitalizing all of them and killing 3. The outbreaks were recorded in Arizona, Kansas, Oklahoma, and unfortunately Texas. And in April was when Bluebell actually recalled all of its products currently on the market. And they did that after some company-wide sampling revealed that the chocolate chip cookie dough half gallons had listeria in 2 different batches. So, first recall in 108 years. Obviously, it left Texans pretty upset. So, prevention. To prevent this disease, you can take some common precautionary practices such as washing and handling your food correctly. So this involves rinsing, scrubbing, and drying raw produce. And you want to separate your uncooked meats and poultries from all your other foods. Keep your kitchen and countertops clean and safe. So wash everything: knives, hands, countertops, cutting boards. And then you want to also keep your refrigerator pretty cold, 40 degrees Celsius or lower, and clean it regularly. You don't want food or anything spilled building up in your fridge. What else? Cook your meat and poultry thoroughly, so it should be cooked to an internal temperature of about 140 degrees Fahrenheit. And in the fridge, you want to store your food safely. So shallow, airtight containers, and if you do have leftovers, eat them within 3 to 4 days, or they will go bad. Treatment: listeriosis is usually a self-limited illness. So this means a majority of infected individuals don't actually need medical care, and they will still get better. If you don't have symptoms and you did ingest or you think you got listeria, experts believe you don't need any tests or medical treatment because it will heal on its own because it's cell-mediated. If you do have symptoms, however, you're treated with antibiotics. And for severe listeriosis, this can include ampicillin and penicillin G. And then babies are treated with the same treatment, with the same antibiotics, but usually more of a combination until the doctors are certain that the diagnosis is of listeria. And the good news, Bluebell ice cream is finally back, so Texans and others alike can rejoice in the glory that is ice cream. Thank you.